of something so much that it affects your life? If so, then you could have a phobia. Well, what is a phobia? A phobia is an extreme or irrational fear of an aversion to something. In other words, the difference between a phobia and a normal fear is being afraid to fly in a plane because of turbulence and not going to your parents' anniversary because you'd have to fly. You've probably heard of claustrophobia or arachnophobia, the fear of small spaces and spiders. These are specific phobias. There are two types of phobias, specific and social. Specific phobia is caused by a presence of a specific object or situation that usually does not present danger. An example, arachnophobia, the fear of heights, whereas social phobia is a strong fear of being judged by others and being embarrassed. Social phobia can prevent people from doing everyday actions, such as simply not being able to go outside, to not being able to give a class presentation. Meet Carol. Carol has arachnophobia, which is a fear of spiders. Now let's say Carol was walking down the hallway on her way to her next class, when all of a sudden a spider approaches her, and her immediate reaction is to scream. Carol's stress levels go up and she goes into the stage of fight or flight response. The fight or flight response arises from a threat reaction from a permanent part of the brain and results in self-protectiveness. It all starts in the brain. The brain cells in the hypothalamus part of your brain trigger the pituitary gland and release the hormone ACTH into your bloodstream. The nerve stimulus travels down the spinal cord and to the adrenal glands, producing adrenaline into the blood. This is when Carol could either choose to fight or fly. Carol's heart rate, blood pressure, and breathing rate increases. Finally, Carol chooses to run away, but her phobia still prevails. So how can Carol or anyone else overcome a phobia? There are different types of treatment that work best for the different types of phobias. There is self-help treatment, which is convincing the mind. However, this is usually hard to jump into and often isn't the first choice for people. Taking medication, however, is also a treatment for phobias. There are many medications that can be taken for treatment of phobias. One is using beta blockers. Beta blockers block effects of norepinephrine and epinephrine, which is your adrenaline, from binding to beta receptors found in the nerves. This prevents a person from having increased blood pressure, heart rate, and shakiness, and most effective for short-term use. Another medication that is more commonly used is antidepressants. One can also take sedatives, which can help someone with anxiety relax. On the other hand, one does not have to take medication as a treatment, but rather they can go to therapy with professionals to help overcome that fear. For example, Carol decides to go to her school counselor to talk about her anxiety of spiders. Her counselor would help her overcome her fear. Carol can do all these things to help her overcome her fears, but she might not actually overcome them. She could only just become tougher when confronted in a situation of spiders. It doesn't even have to be spiders. Carol could talk in front of a crowd of people and still want to run because of her flight and fight response. If it helps, whatever you're scared of is actually probably more scared of you.